So within the last century, police use of force has been under an extremely harsh spotlight. Numerous incidents have actually gained national recognition and in turn have led to violent reactions from the public. Excessive use of force has been a growing concern in America for quite some time now. And some argue that it's actually reached a boiling point in the last few years, which can be seen in numerous different formats, whether that be violent reactions from the public or even just your average protest that's been ongoing throughout the country, even to this day. Use of force can mean numerous different things, but mainly it focuses on lethal, non-lethal, and the legality behind the actions of the force used. So most of the renowned incidents that we're going to be talking about are the ones that have involved lethal force, and that's what this practice kind of focuses on. So the proposed best practice is streamlining the use of force policies for police departments and setting the use of force standard. So the best practice mainly focuses on using more de-escalation tactics such as mental health training and other non-lethal techniques to ease those situations. So the first issue that this will address is matching the use of force to different situations in which a deadly encounter could occur. So generally speaking, this will be focused more on subjects who are not wielding a deadly weapon. So the first step in fixing potentially dangerous encounters with police officers is by raising the standard by which officers can actually use their service weapon. So whenever a service weapon is drawn, the survivability of the situation drops for a suspect involved and the officer as well. So drawing a service weapon escalates the situation much higher than it often needs to be in many different situations. So one important principle of this practice is setting a higher standard for when the service weapon should actually be drawn, and only when a suspect or incident is threatening the officer's life or their own lives or an innocent citizen's life. So, however, the officer will still be granted that discretion to draw their service weapon if deemed necessary enough. So discretion would obviously be used for officer safety and public safety, and emphasize that weapons should only be drawn when suspects are at risk of harming themselves, the officer, or civilians nearby. This is different than what a lot of current agencies do, as most agencies deem it appropriate to draw a weapon as soon as the officer believes the force index is above a certain threshold. Redefining what this threshold is, so suspect brandishing a deadly weapon, for example, would help eliminate unnecessary escalation in police encounters. The practice, would include standards such as an officer walking into a building, where a suspect is hiding and potentially armed, if the intelligence is good enough, where the office already knows that the suspect is armed and dangerous. But the main point behind the first part of this practice is targeted at officers who draw their weapons for minor infractions or situations in which it is entirely unnecessary. For example, a suspect having a mental health crisis. So this would help de-escalate numerous different situations, and more non-lethal techniques would be introduced as alternatives for instead of drawing a service weapon. Another portion of this practice is introducing more mental health measures, especially in the last few years. This has been an ongoing issue. So introducing more mental health training would help officers become more confident in using these techniques. So the reason behind this is that with more mental health training, officers will be able to understand how to interact with citizens who are going through those mental health emergencies or incidents. So mental health training has actually proven very effective in de-escalating situations where deadly force may have been used. So often these situations can actually be diffused very quickly, so long as one does not escalate the situation at hand. The American public also views taking mental health measures more favorably. So many police departments do actually have guidelines that briefly mention mental health, but nothing is entirely set in stone. Introducing these basic guidelines for officer training regarding mental health could reduce the number of deadly encounters between police and citizens. Incorporating mental health into department best practice is actually crucial for improving police and community relationships. So one shining example of this is the crisis intervention team. So this is actually based out of Memphis, Tennessee, and the program trains and provides resources to officers in mental crisis and dealing with mental crises. So the CIT program is different from its counterparts because it actually includes joint involvement from many different agencies such as like EMS and trained mental health professionals. So all the entities work together to help citizens who are going through those mental health crises or episodes and get the help they need with minimal risk to everyone involved. So overall, This program has successfully reduced the use of deadly force, and it actually has helped to de-escalate a lot of situations where that officer may have decided to use a service weapon or another less than legal technique to subdue that suspect. So, by streamlining these use of force standards and incorporating more mental health assets into criminal justice agencies, there will be fewer use of force incidents and deaths caused by lethal force. Targeting level escalation at which officers draw their service weapons is integral to this best practice, because raising the standard at which officers draw their weapons and incorporating more mental health into agencies, there will be far fewer incidents between the police agencies and the American public. So the evidence of effectiveness in raising the standard for the use of force is promising. So by raising the standard to draw a service weapon, there will be a lot less escalation in these situations, and it'll be more survivable to all other parties involved. A recent study from 1999 to 2013 regarding legal intervention deaths, so that's just law enforcement using lethal force, has gone up by 45%. In all these situations in which deaths have occurred, they're different, obviously. Many are likely correct in using lethal force to dispatch the threat. However, this number can be lowered if officers do not draw their weapons as quickly and focus on those de-escalation tactics and using non-lethal means to dispatch the threat. Using non-lethal tactics to subdue offenders is also effective in reducing law enforcement-involved fatalities. There are many different levels to responding to force presented by a suspect in each different agency. This is largely due to different needs of each agency, as the FBI and the local police department are going to have different needs for using force. The way that policing is set up in the United States focuses on local, state, and federal levels. The reason for this is essentially checks and balances, so that not one department or agency holds all the power in a specific region or area. So, in a random selection of 400 taser deployments, the success rate in subduing the suspect was 68%, which is pretty high. A lot of those misses can be contributed to the officer just actually missing the suspect with the taser, which is, again, lack of training on de-escalation and non-lethal tactics. Chemical sprays are also successful in subduing offenders with a similar success rate to that of other non-lethal means. So studies from the early 1990s found that OC spray had a 90% effectiveness rate. However, it is going to probably go down due to more use of the taser. Chemical spray is an excellent non-lethal means, as it does have a shallow risk of the suspect requiring medical attention afterward. Training in mental health also is an effective way of reducing excessive force between law enforcement and the community. When provided with proper training on mental illness, officers can identify stabilization and de-escalation tactics. Officers can also learn about disposition options and local resources to help resolve incidents. So the Bureau of Justice has introduced the PMHC program, which is the Police Mental Health Collaboration. And basically what this program does is just begins training officers on different mental illnesses, what are the signs, how people react when they're going through a certain mental health emergency, stuff like that. And the PMHC is a step-by-step program that enables police departments with the proper funding and resources to help train officers on specific mental health-related de-escalation tactics. And it also, again, provides some knowledge about common mental disorders that would often result in police resorting to force as opposed to addressing the mental state of the subject. So overall, the problem with excessive force has gotten the attention of every citizen in the United States at this point, and it has crossed into international news time and time again. Using excessive force not only violates a citizen's Fourth Amendment rights, but it causes outrage and distrust in law enforcement throughout the country. Excessive force is not a new thing to the American public. Throughout history, there have been large instances of using excessive force. This is primarily seen in the early 60s with the Civil Rights Movement, where excessive force was rampant. So employing a streamlined use of force policy would lower the distrust of law enforcement in the community among the American public, and increasing the standard by which officers are able to actually draw their service weapon would help set a standard for when lethal force is authorized. Practice would also push for officers to use more non-lethal tactics and more mental health measures. Tasers, pepper spray, and other such means have proven effective in increasing the survivability of police encounters for all parties involved. By introducing more mental health training, officers would be able to assist significantly in situations where mental illness is misdiagnosed by law enforcement as violence or resistance. This practice would reduce excessive force, since it would set a clear line that officers cannot cross. This practice would reduce excessive force as well because it would be eliminating that gray area in which police officers are debating with their discretion whether or not to use lethal or non-lethal force. Utilizing this best practice as standard across the country would help prevent the use of excessive force and reduce fatalities in law enforcement encounters.